And I finally concluded that there was nothing you could change, not staff productivity, the costs of supplies or labs. There was nothing had as much impact on how much dentistry each patient bought, or what we call case average. So when you're looking for profitability, nothing has more impact. Wes, can you really expound on case average? Tell us what it means and how it fits in.
Sure, Greg. Let me first start off by explaining how we calculate case average. It's all new patients divided into all collections. You can do it best is through an average. So average new patients seen per month divided into average collections per month. So let's take $100,000 of collections and 25 new patients. If we divide those, we're going to get a $4,000 case average. Let's talk about what's good and what's bad and the pros and cons about having a very large case average and a very low case average. What we consider a good average here at Whitehall is 2,500. That means that you're hitting the middle. We know that you're probably not overselling patients at that point, and we know that you're developing the cases nicely. A low case average would be $1,200 per new patient. Usually the reasons why that happens is advertising. You get so many new patients and you really don't have the chairs, the doctors, the staff to develop the cases or the time. And advertising patients statistically spend a lot less than referrals.
There's actually a number that we use for a calculation. We call it the Patient Management Index. Because some of you are probably concerned about the time you're hearing all this, that this leads to you showing huge cases and hard closing patients.
Right. That's the trade-off.
Right.
That's what the other side of it. So you start off with the low case average. The other side of it's the super high case average of like $8,000 off of 3 new patients a month.
And you wake up one day and you have 2 new patients coming into the practice.
Right.
The Patient Management Index is simply this, where you lay your case average side by side with your monthly referral. So let's say you've done the calculation that Wes mentioned. You've divided your new patients into your total collections. And let's say, again, that you had $100,000 of collections for a month or a quarter, whatever, and you divided it by 25 new patients for that same period of time. You would have a case average, as Wes pointed out, $4,000. Now, that's a high number. Wes just told you that $2,500 is actually pretty good. In fact, here at Whitehall, we don't recommend people usually advertise unless their case average is $2,500 or above. They have a hard time making enough money off their investment to feel like it was worthwhile.